I still have one of the symptoms, a minor symptom of I still have a temperature.
It was, it turns out, an understatement. His persistent fever and cough were just days later to put the Prime Minister into St Thomas's Hospital and from there last night into intensive care.
Intensive care is used for patients that can't be managed on the ward. So these are patients that are deteriorating or may possibly deteriorate very quickly. So we would take a patient into the intensive care unit and know that we have all the correct staff, we have equipment such as ventilators that we can put them on should the need arise.
There is so much still not known about COVID-19, and one of those questions is, why do some people become seriously ill while others are fine? The Health Secretary and Boris Johnson were infected at around the same time. Matt Hancock is now back at work. And there is the question too, why do some patients seem to be on the road to recovery and then dramatically worsen? Average incubation for COVID-19 is 5 days, but can be as long as 14 days. The majority of people will have a fever and a dry cough, while others may have mild or no symptoms at all, but will still be carrying the virus. After a week, most have recovered. And then there are those, like the Prime Minister, who develop a more severe infection. The lungs become inflamed and they have trouble breathing. At this point, they are usually taken to hospital and put on oxygen. A small number become critical, unable to breathe on their own, and this is when they are put on ventilators. These patients often develop pneumonia, and with oxygen levels in their blood dropping, they can have organ failure, and in some cases, sadly, they die. A Downing Street spokesman said the Prime Minister was receiving oxygen and breathing without any other assistance. Being admitted to ICU, we were told, was precautionary and that he is not on a ventilator. Dominic Mangala was brought to King's College in South London in a similar condition to the Prime Minister, and he told us today of the relief once he was given the oxygen.
I think there's a kind of crucial moment around sort of day 7, 8, 9, where particularly guys apparently are reluctant to call for help, and it's particularly guys who overwhelmingly get themselves into a critical situation. And so I'm glad that Boris Johnson's gone in, and I'm glad he's near a ventilator, whether he needs it or not, because the other thing we know is that you can deteriorate really rapidly. And he'll know that. He'll know much too much about this virus for his own comfort. And I'm glad he's near the best care that they can give him.
The problem for doctors treating the Prime Minister is there is no cure and little in the way of treatment. There are trials looking at HIV, rheumatology and malaria drugs, and patients have been given these, but they are not licensed for use in COVID-19. The fact is, the disease is too new. One day it is hoped, though, that the research will answer why Boris Johnson and so many like him end up in intensive care units, and why, in too many cases, there are those who simply do not survive.
Well, Victoria is with me now because every day we've been given the official figures for the number of people who've died after testing positive for coronavirus from the Department of Health. But new data from the Office for National Statistics suggests that the true figure could be much higher. Our health and social care correspondent, Victoria, has just joined me in the studio. Explain.
This is rather complicated to explain, but the point is the figures that we're given every day include time lags. You know, there are some hospitals that simply don't have time to fill in those forms, or they have to tell relatives. So these figures are incomplete. Now, there is no conspiracy, although I'm sure some people are finding a conspiracy in there. But today, the Office for National Statistics has put together all the deaths: hospital, community care, nursing homes. On the death certificates, it has to say COVID-19 or suspected COVID-19. So look at this graph here. This is the best measure, is up to March the 27th. This is where the ONS figures go to. So we were given the figure for that day. Up to that date, 926 people had died. The ONS figures show that the number of deaths was actually 70% higher, 1,568. Today, the accumulative figure is the number of 5,655 for England only. Now, if we had the ONS figures, that would suggest that the true total is more than 9,000. Now, this obviously illustrates that the toll is far worse than we're being led to believe. And again, I have to say that this is not a conspiracy. All countries have trouble recording deaths. They're looking for different ways. We do it in different ways, but it also makes it then, you can see, difficult to make a comparison with, say, where are we compared with Italy or France or the US? And we are waiting too for that figure. There's the 20,000 figure of the number of deaths expected if we did the social distancing and closed the schools. So we have to ask, are we nearly halfway there, or is that figure wrong?
We're joined now by Hugh Montgomery. He's Professor of Intensive Care Medicine at University College London. Thank you very much for joining us, Professor. What would make you decide to move a patient into intensive care?
So essentially, it's the trajectory of the patient. We've heard that these patients become short of oxygen, what we would call hypoxic. And it's partly the level of hypoxia, how much oxygen one requires, but also actually the look of the patient. These people often have very high work of breathing. They're often breathing very deeply and very fast. And those are the sorts of patients we watch very closely indeed, because while some remain very stable, others can fall off their perch very quickly indeed. And by very quickly, I'm talking minutes, half an hour to an hour. And that's why they're put in there. The same treatment everyone will be getting. This won't be preferential. This will be what would happen to anyone. Put him in a place where if he declines suddenly, he'd be in a place where extra support could be deployed straight away.
Do you sense that we are reaching the peak of this outbreak? I mean, a lot of patients seem to be being moved to other hospitals. Is that a shortage of beds or a genuine sign that we may be getting there?
No, at the moment, I'm not feeling it. I don't know what the current data are in terms of slowing. I looked for our sector in North London that there was a bit of a slowdown that's now picked up again. And we're intubating the same number of patients every day now as we have been pretty much. So there's no signs for us of a slowdown. What's actually happened is that the existing number of intensive care beds were exhausted a long time ago. And trusts expanded up their capacity to take critically ill people by opening up beds in operating theatres or out on wards and staffing them in a way we wouldn't normally have done. So we're staffing them with, instead of one ITU nurse per bed, it's now one ITU nurse for perhaps 6 beds with supports of others at the bedside.
Well, that leads me to ask you about the Nightingale Hospital. Is that actually now working? Are there patients in it, or it's still waiting to go?
My understanding is that the first patients would be admitted there today, and I've not phoned up to find out, but it was my understanding that there would be patients there by this evening. And it's the right thing to do to prepare that backstop. I've heard it raised that maybe we won't need those beds and so forth, but if you haven't got the capacity built in, then it's not there and you can't do it in a hurry. So it was the right thing to do. And we are overflowing. So our hospitals in North London, many of them are now transferring to expanded capacity in what are known as surge or super surge centres. So UCLH down the road from us, for instance, taking those. And once those are beginning to overflow, then the flood will then move down to XL.
Victoria MacDonald just now reported that the Office for National Statistics is reporting that the number of deaths could actually be twice what has been officially confirmed. Would that tally with your experience? What would explain it?
Yes, I think it probably would. And it's partly to do with registration of death. So there is a process for anyone who has been bereaved. There's a process, of course, of filling in a form, the form then being registered and that registered cause of death then being documented. So there will be a lag of the ONS statistics, so the National Registry, behind what's happening on the shop floor. And I can't tell you how long that would be, but there will be a lag. I think probably early on as well, there might have been deaths that people were less aware would have been coronavirus. We've now got to recognise that pattern of disease really quite well. So even if the test is negative or if someone dies before the swab is back, we're able to write with confidence that it's coronavirus or suspected coronavirus. And I think that will also account for the numbers becoming sort of higher as the days go by.